For many, periods bring more than just inconvenience. They bring intense, often debilitating pain called dysmenorrhea. It affects up to 90% of people who menstruate, and for at least 10%, the pain is so severe it disrupts daily life. This isn't just cramps. It can feel like labor, radiating from the pelvis to the back and thighs, often with bloating, nausea, and exhaustion. Pain levels vary widely. For some it's mild, for others it's overwhelming and barely touched by medication. This variability leads to misunderstanding and dismissal, fueling a culture of silence and endurance. The pain starts with the uterus shedding its lining, muscle contractions that can be mild or excruciating. These contractions, necessary for menstruation, are the root of the pain, but their intensity differs for everyone. It's time to recognize period pain as a real medical issue, not something to be minimized or ignored. No one should have to suffer in silence. Not all period pain is the same. There are two main types, primary and secondary dysmenorrhea. Primary dysmenorrhea is the most common, starting soon after periods begin with no underlying disease, just the body's natural response to menstruation. It's linked to chemical changes, not structural problems, and often improves with age or after childbirth. Secondary dysmenorrhea, however, is caused by underlying conditions like endometriosis, fibroids, or pelvic inflammatory disease. This pain often starts later in life, lasts longer, and can worsen over time. It may come with heavy bleeding or pain during sex and doesn't always respond to typical treatments. Recognizing the difference is crucial for getting the right diagnosis and care. If your pain is getting worse, lasts beyond your period, or comes with other symptoms, it's time to see a doctor. Understanding the type of pain is the first step to effective relief. Period pain is not one size fits all, and neither is its treatment. So, what causes primary dysmenorrhea? The answer: prostaglandins. These hormone-like chemicals made in the uterus trigger muscle contractions to shed the lining. High prostaglandin levels mean stronger, more painful cramps, and can even cut off oxygen to the uterine muscle, intensifying pain. Prostaglandins don't just cause cramps. They can also trigger nausea, vomiting, and diarrhea by affecting other organs. That's why period pain can feel like a full-body assault. The good news? NSAIDs like ibuprofen work by blocking prostaglandin production, reducing both cramps and other symptoms. Taking them before pain starts can make a big difference. Understanding prostaglandins is key to understanding and treating period pain. It's a chemical battle, and now we know the main culprit. For centuries, period pain was dismissed or blamed on female weakness. In the 1920s, bizarre theories like the menotoxin myth only added stigma. Real progress began in the 1960s, when scientists discovered high prostaglandin levels in those with severe cramps. This breakthrough shifted the focus from vague advice to real, targeted treatments. NSAIDs became a game-changer, offering relief by blocking prostaglandin production. Hormonal contraceptives also help by thinning the uterine lining, reducing prostaglandin levels and pain. Science finally provided answers and hope for millions. But the journey to understanding period pain is far from over. We must keep pushing for better research and solutions. Today, NSAIDs and hormonal contraceptives are frontline treatments for period pain. For many, they offer real relief, but not for everyone. Some can't tolerate these medications, and for those with secondary dysmenorrhea, they may only mask deeper problems. That's why it's vital to take persistent or worsening pain seriously and seek a proper diagnosis. Research is now exploring new factors: inflammation, pain processing in the brain, and even the microbiome. Untreated pain can sensitize the nervous system, increasing the risk of chronic pain later in life. We need more research, better treatments, and faster diagnosis for conditions like endometriosis. Dismissing period pain as normal is outdated and harmful. It's a complex medical issue deserving real solutions and compassion. No one's life should be defined by their